Hello and welcome. I'm Dr. George Lundberg, Editor-at-Large for MedPage Today. And we are talking this morning with Dr. Robert Bonow, who's the Distinguished Professor of Medicine, Director of Cardiovascular Innovation at Northwestern University's Feinberg School of Medicine, and I believe a former president of the American Heart Association.
Yes, sir.
When was that?
2002, 2003.
Okay, a little less than 10 years ago. So thank you for taking a little bit of time to talk to us.
Delighted to be here.
We're just going to talk about things of great interest to you and where you have a lot of knowledge, and things that are probably of great interest to our American physician prime audience.
Well, there's a lot to talk about, George. There's so many areas of contact here that we can talk about. So focusing on this, much of this is socioeconomic. And when we talk about disparities that are ethnic or racial, most of that really is related to socioeconomic status, because we could also be talking about poor white people in certain areas of cities or in the country.
Yeah, but it also happens in Medicare patients, and it happens in the VA hospital.
It happens throughout.
So that isn't socioeconomic.
That's true. So that's, I think, the point, is that even when you have equal access to care and equal insurance coverage, we still see differences in the way people are treated, the way they have access to care, access to interventions once they're in a hospital, underutilization in some cases, or maybe it's overutilization in other people. But there's clearly a difference, but it also translates into difference in the outcome. So it's not only differences in what we do, what medicines we may give, but the bottom line is that the outcomes are worse. So when we look at this across the board, one continues to see that from a cardiovascular standpoint, the cardiovascular death rate, morbidity rate is much worse in for example, African American men, African American women compared to white people, and so we have not cracked this precisely the way that we need to.
How about Hispanics?
Hispanics are a big part of this too. See, part of the issues of I think disparities is trust in the system as well. Maybe you're actually in a system that can provide care, but there's questions of language, questions of culture, and trust. Maybe based upon previous history as well.
And when you get into language, culture, and trust, Asian cultures are quite different than American culture.
I mean, this is so important for us, because especially in the Hispanic community, which by 2050 will probably be 30% of the U.S. population. We have cultural differences, language differences, and yet a huge cardiovascular risk among the Hispanic population, Latino population, with obesity, diabetes, lifestyle, that really needs to be tackled a little more head-on.
How are we doing that? Is Northwestern doing it? Is the American Heart Association doing it? Is the United States government doing it? NIH? Are the media doing it? How do we become colorblind in our own approaches to things, as well as where the money flows and where the treatment flows?
Well, it's got to be at those various levels. No one person, no one institution can conquer this one. It really does take a concerted effort for all of us. Part of it is awareness. Part of it is kind of a joint effort. We need to have probably more research into what's going on, how we can maybe design systems of care that might be more applicable to Hispanic population, African American population. Maybe the messages need to be delivered differently, maybe not from a healthcare professional, but maybe from a church, maybe from some other civic organization where people may be congregating, hearing it from inside instead of from the outside, having the right languages. So in my hospital, what's my hospital doing? Well, we have bilingual signs, so that people can find where they're going and they can find their physicians.
I live in California. In San Francisco, it's more like 19 languages in many of the hospitals, for real.
Yes.
Okay, well, what would be a take-home message for practicing physicians in the area of health disparity now? And you tell me, or tell them directly.
There's many aspects of this. I think, again, awareness of the issue. When you do surveys of physicians, they're aware of disparities. When you ask them whether their patients are getting equal care, they all believe that they're doing a good job. That is someone else's problem, that they're aware of this and they're doing a good job, and it's probably important to make sure that physicians are aware that maybe they're not doing as good a job, and their nursing staff and the team entirely needs to be on top of that particular issue. Being a little more culturally aware, being especially if we're talking about the Latino Hispanic population, that having people with language skills as well, who can be part of the team approach to care.
And how about having appropriate numbers of physicians who represent the groups where the patients come
Well, that's
from?
important, and it's also difficult because we have a lack of minority physicians right now, and with the growing Hispanic population in particular, there's very few Hispanic speaking and Hispanic
I'm not
cultural.
sure that's getting all that much better. So I think what you've outlined here is a multi-layered problem in which, if we get a solution or work at solutions, they're going to be multi-layered solutions. Well, thank you very much, Dr. Bonow, for being with us today. Good luck on your quest for equality in health and health delivery, etc. And thank you for being with us as well. I'm Dr. George Lundberg, signing off as the editor-at-large for MedPage Today.